Welcome back to Bahamas at Sunrise. April is Occupational Therapy Month, and it's time to learn about all the benefits that this specialized healthcare provides. Here to talk with us about this are Zanovia Neely, the clinical manager and occupational therapist at Doctors Hospital, and she's joined by Dr. Kereen Sherwood-Wallace, who's the director for rehabilitation services at Doctors Hospital. Miss Neely, Miss Sherwood-Wallace, good morning and welcome to Bahamas at Sunrise.
Good morning.
An absolute pleasure to have you both with us. And I guess the first thing people really want to know whenever you hear it, because it's, unless you need it, unfortunately, many people don't know about it. And so how do you define occupational therapy?
So occupational therapy is a healthcare profession that focuses on function. OT is very unique because our interventions are centered. First of all, they are client-centered, so the involvement of our patients are very important to the intervention and treatment plan. But we want to focus on the occupations that patients and our clients are unable to perform due to illness or a condition, an injury, that definitely will impact how they are able to be independent in those areas. And so for OTs, occupation is a lot more than just your employment. It's everything that you do. Occupation can look like play for children. That's their occupation. That's the way that they engage and they interact with the environment. Occupation can also be your actual employment. So any condition that's preventing you from being at your best, an OT consultation can be indicated. Also, ADL, so activities of daily living, and at its basic, that can be dressing, feeding yourself, basic grooming. And then sometimes we even look into our instrumental activities of daily living, and that involves a little bit more of executive functioning, multitasking. So that can be caregiving or driving, meal preparation, those activities that involve a little bit more of your cognitive abilities. So in general, these are the areas that we want to focus on. We want to make sure that we maximize one's function and independence in these areas. And even when you're unable to function 100%, or you're unable to, those functions are able to return 100%, OTs can find ways and alternatives to how you can adapt the environment, how you can adapt the activities so that you can still function, so that you can still have some meaning and quality to life.
Wow. So it sounds like you all do a whole lot. And that's why I'm so happy that we get to have shows like this where we get to explain the work that you do, because it includes every function that you don't even think of because it's become so naturalized to the body in the current state. Of course, if someone is seeing an occupational therapist, that means that something might have happened that therefore requires them to relearn these skills. And so, Dr. Wallace, are you able to let us know when a person might need to see an OT?
Well, Zanovia did a good job at explaining, what is OT, and that kind of leads us into why someone might need to see an occupational therapist. And this is OT month. I am the director. I'm a physiotherapist, so I'm just gonna let her shine a little more, and she can further explain, what are some of the reasons.
Certainly. And so tell us, Zanovia, why is it that somebody would need to see an occupational therapist?
So as I mentioned previously, if there is a condition, so let's say you might sustain a stroke, or maybe even just an upper extremity fracture. When you're unable, especially if that is your dominant hand, you do everything with that extremity, and now you're unable to perform those routine tasks, those meaningful activities. If you're a mother, you have difficulty holding your children or preparing them for school, and you cannot type if you're at work or even feed yourself. So any condition, any injury, any illness that affects your ability to perform those routine daily tasks, as great or small they may be, that's the right time for you to have an OT consultation. And so what we would often do is assess the patient, the client, to see exactly what areas of function they're having difficulty with. And that helps us to decide, are we going to perhaps use therapeutic exercises? Are we going to integrate some activities? Are we going to have simulation of your functional activities, so that you can improve or establish, restore those functions again.
Wow. All right. And then you've talked to us a lot about, so many different people that would need OT. I love that you talked about moms lifting their children just now, because that immediately clicked with me and made me connect with, every basic thing that we do every day and we take for granted. What are some of the different interventions that occupational therapists provide?
So OTs work in a number of settings. So we work in the hospital, we work in the outpatient clinics, rehab clinics, within the community. And so just as varied as the settings are, as varied our specialty in terms of what we do and what type of interventions we provide. So, for example, our hand therapist, our OT that's a hand therapist, may use, the biomechanical techniques, more therapeutic exercises to engage that patient, to help them regain the range of motion or the muscle strength that's required for them to carry out their daily tasks. We also have OTs that work, again, with the pediatric population, and autism or children on the spectrum. So in that case, we will use activities for those patients. Sometimes we may use exercises, or we can also incorporate activities of daily living. So having that child practice how to dress themselves, how to plan toileting, how to communicate as well their needs. We will have them simulate feeding within the clinic. And so there are many interventions that can be used based on the setting, based on the condition, based on the general condition of the patient.
Wow. Yeah, this is powerful stuff. And I'm sure that there are some people who are just happy to be hearing this information for the first time, because so many of us don't think about it until something goes wrong. But there's something called ergonomics, right? And that has to do with perhaps preventing injury at work even before it occurs. Can you elaborate some more on that?
Yes, so ergonomics, such a hot topic, especially with the pandemic. A lot of persons are working from home, but even previous to this period, ergonomics assessments were very popular for those that were in their office or their workstation at wherever they are employed. So the goal of ergonomics is to modify the environment to fit the individual that works within that environment. So a lot of times we want to fix the person, and that's a part of it as well. But sometimes when we're experiencing strain or repetitive injuries, repetitive movement injuries, it's really due to our workstation setup. Perhaps the desk is too high. Perhaps the chair is a little bit too small, or doesn't have the features or the accessories that's necessary, or the monitor is too low on your desk. So what we want to do is assess that workstation and identify risk factors. And those risk factors can be environmental. So that's directly, your monitor, your keyboard, your chair, your desk, or it can be your posture. Maybe you just have poor posture. You're slouching in the chair, you're bending or overreaching a little bit too much. Perhaps your job involves a lot of repetitive movement. You're typing a lot, writing a lot, constantly rotating your neck or flexing and extending it. Maybe you have your wrist in a flexed position or bent position for a prolonged period of time. So we want to observe the person within their natural working environment, whether that be at the office or in their home. And once we identify the deficits in function, then we look to solutions. How are we going to resolve this issue? Measurements are taken. There are standard measurements for your workstation. We want to make sure that that's correct. We want to also implement things like your 90-90 rule. When you sit at your desk, there should be a 90-degree angle at your hip, knee, and ankles. We want to make sure that you are maintaining a neutral position, whether you're at a standing or a sitting workstation. So that's a little synopsis of what ergonomics is.
And it's so important, right? Like we take for granted how much even just looking down impacts like our neck and our spine. And, so I love that we get to have these conversations on Bahamas and Sunrise, because it awakens our minds to things that we just take for granted until it's too late. So this has been a great conversation. Before we go, I am going to come back to you, Dr. Kereen, and just find out, what are some of the other services that Doctors Hospital provides in terms of rehabilitation?
So I just want to put it together, in terms of ergonomics. We also have, it comes under the umbrella of kind of a worker rehab kind of program, and that's or a vocational rehab program. And that's something that we offer at Doctors Hospital Rehab Services. We offer functional capacity assessments, work site analysis assessments. So basically we come to your office or wherever you are, and we can perform an assessment to see how you're interacting with your work environment. And we do offer programs also, such as to check if you're right for the job, right? In terms of, do you have the physical capacity to perform the job that you were hired to do? So we also do pre-work assessments, that kind of a thing. And so other services that we offer here at Doctors, last time I think we were talking about our cardiac rehab program that we recently launched. That's doing pretty well. I think the patients that we have in the program, they were very excited and appreciative of such a program. So that added some support to what they were currently doing as part of their medical regime. We also have our post-COVID programs for our long haulers. That's going on as well. And we're offering service bundles. So we're the only place to probably offer speech therapy, occupational therapy, physical therapy in that same space. And we realize that the costs can be an issue. So we're offering discounted programs for those persons who want all those three services, or maybe even need just two of those services. And also, I just wanted to tie in that we're opening our new facility in on Carmichael Road pretty soon. The Doctors Hospital Carmichael is open. Right now, I think they're offering laboratory services, but rehab will be on board quite pretty soon. So look out for that. But overall, we are here to support the community, and we're here, Doctors Hospital Rehab, just to ensure that you get the best in terms of recovery from physical ailments and injuries. So yeah, that's us. We're a team of pretty relatively young individuals, so we're very high energy and very excited. So you can follow us also on our Instagram page or Facebook page as well.
All right. So and that Facebook page is Doctors Hospital, or
right,
is it
Doctors Hospital Rehab Services. That's our Facebook page. And our Instagram is DH-rehab. So once you put in Doctors Hospital, you can't miss us. And you'll see our lovely team there. Or you can contact us at 302-4636. And we can provide further information for you.
Excellent. Well, it's been a great morning. Every time Doctors Hospital comes on, we learn so much. And this has been great learning about OT. I'm sure that people have so much more knowledge now, because it's one of those things, speech therapy is quite clear. And physiotherapy is quite clear, but you have occupational therapy, and many people don't understand it. So this has been a great conversation to have with you, Zanovia, and a great conversation to have with you, Doc, about everything that you offer all together. Love that you have those bundles. I'm sure the
Can I
Carmichael
just shout out our
population is
OTs? I
ecstatic.
forgot. Can I just do that
Sure, go
quickly?
ahead.
Okay, so of course, you know, Zanovia. We also have Amy Etor, and we also have Jordan Moxie as part of our team, and Edward Russell, who is our OTA. So we have an excellent team of OTs at Doctor's Hospital. We just want to say happy OT month to them.
Happy OT month to them, especially to my friends Jordan and Eddie. Appreciate all of you and all the work that you do to get us back to working fully and even to preventing some injury from happening. Thanks again to both of you for joining us this morning on Bahamas at Sunrise.
All right, thank you for having us. Bye.
You're watching Bahamas at Sunrise. We'll be right back.